So, moving on to week 8, but I want to take a minute and kind of recap our discussion from week 7. Been a very good discussion about collaboration. You covered a range of topics. James brought up the whole mental health and PTSD in particular issues. We talked about discharge from the acute care facility to skilled nursing, oncology, and palliative care, which really, I think, have the model for collaborative care down pretty well, and the kind of experiences that occur, the interdisciplinary team meetings, IDT, that happen in hospice care, for instance, great examples of collaborative care. Jenny brings us such a good perspective with the long-haul truckers and the kind of work that she does with that population, and the lack of sometimes a referral ability to do collaboration. And that got us into a great discussion about the electronic medical record, and the fact that perhaps if we just had a better record, we could do a lot of things collaboratively because, and as I mentioned, I think in the post back to, in response to that, so much of our work together in collaborative work, and many of you brought that out, is about communication. In the healthcare world, we communicate, of course, directly with patients and families and, in settings with other healthcare professionals. But for the most part, continuity is ensured by communication in their medical record. It's been historic in the way that we, kind of enable the next practitioner and the next nurse, the next other health professional to work with that patient, knowing some of what has gone on previously with the patient. So it's critical to have a better system. And Jenny did a really nice job describing the evolution of the electronic medical record and how that has kind of evolved into something that is so almost as fragmented as healthcare itself. Many different companies getting into the field, software applications that don't communicate well with each other. In the very beginning of the electronic medical record, we had situations where the pharmacy had a completely different system from the main hospital, and you couldn't you couldn't merge them. You couldn't even order together. We still were faxing and that kind of thing. And we've come some way since then, but not that far. And we still have lots of problems with that. And I mentioned a couple of other things I think are difficulties, default settings and that kind of thing that really can allow for some inaccuracy in the record. But this discussion on continuity and collaboration for care, there's a great point about the difficulties with the electronic record. And I think James's idea of an app is a good one, even though it wouldn't solve all the problems. It would give patients, and empower patients a little bit more. I think there are some things that do that, certainly Fitbits and diet apps and ways to keep, track of weight loss and that kind of thing. And I think some of those can even be communicated to the healthcare provider. But the idea of having something that would have your history and your allergies and your medications and some of that information you just have to repeat over and over every time you go to a new provider, that would make a lot of sense. So I think that's a potentially good idea. So anyway, really good discussion, and it talked about a lot of very important things about collaboration and some of the obstacles there are to really achieving better collaboration. Thank you, Emmanuel, for bringing up the IOM and the various mandates that the IOM has put out, asking us, begging us, requiring that we do a better job, not only to prevent error, which of course is critical in the first IOM report about to err is human, and really focused on that. The lack of communication among health providers is one of the primary reasons for error. So that's critical. But also because we would enable better quality care, and the Future of Nursing report that he cites really, needs to call us to action to do a better job collaborating, and also a better job, ensuring a systematic evidence-based approach for care for all of our patients. So these were very good points. about collaboration, and in some cases the lack of. And it is something that you're going to address in your case study. What other professional groups could be involved, or should have been, or were involved in this patient's care, and how could that have improved the situation? So this week we've covered some kind of general things now. So now the way the course has been structured in the past, and unfortunately it doesn't exactly match this text, so I'll tell you how I've tried to kind of accommodate for that, but is to go by the lifespan and talk about all the various health promotion, disease prevention issues, topics, as we look at OB and infant care, young child care, school age and adolescent care, young adult, middle adult, and then the older adult, and so what the various issues are in each of those aspects of the lifespan. So the next 3 chapters that we're reading, 6, 7, and 8, kind of look at nutrition, activity, and stress management, and they look at those across the lifespan. So you can either choose and read the parts that apply for this week's discussion, OB and infant care, or you can read the chapters, and then you're going to really be in good shape until about week 13, when because we're going to be covering each of these aspects of the lifespan. So I've posted 2 discussion questions that have to do with maternal and infant health and nutrition, activity in particular. But for maternal health, if you choose, you could go in the direction of stress management, because that's of course a critical thing. We know, and there's some materials posted in the week 8 module about things like the Edinburgh postnatal depression scale. We know mental health issues, even in a healthy woman, can be issues during pregnancy, and then if you add in perhaps some mental health issues, and we know how common they are in the population that already pre-exist the pregnancy, we really have potential challenges for a healthy pregnancy and a healthy infant, and then care of the infant. So if you choose that direction, that would be fine instead of nutrition or exercise. So choose one of those aspects, see the question, and then hopefully the readings will help inform you. And then there's some additional information in that Module 8 folder. There's also 2 PowerPoints that we had used from the previous text, and I just left them. They're there for your information and might be helpful to you. So look forward to your discussion. You can choose one of the areas. You don't have to answer both questions, but then try to answer somebody else's different question so you get that perspective as well, if that's clear. So it'll be interesting to go forward now and, from conception to old age, and see the various issues and health promotion challenges in those groups. And so, we'll have discussion sometime. I've used like interviewing or more of a blog, and I'm still investigating how we could do a little bit more of a blog, so I'm working on that. So look forward to our discussion this week, and hope you have a good week and good weekend. Bye.